Good morning, Tri-State. Two medical heavyweights are going toe-to-toe over a new surgical facility in northern Kentucky. Christ Hospital wants to open up a new facility, but St. Elizabeth says it's bad business. I'm joined, when you talk about speaking of business, by Business Insider, WCPO.com's Dan Monk, who's been covering this story now for months. And this, as we mentioned, are two big hospital organizations going head-to-head about moving into northern Kentucky. What's the holdup here?
Well, the holdup is the Certificate of Need process. That's a Kentucky regulation that requires hospitals to prove there's an actual need for something they want to build, and it's a regulatory process that Kentucky has had for decades. And Christ Hospital applied for a Certificate of Need. St. E. is opposing it.
So what Christ Hospital is saying is basically, if you're in northern Kentucky, you can only go to a St. Elizabeth system for the most part.
Yeah.
They control anything south of the river here. Yeah. They want fair competition or competition.
They want some competition. They say that St. E. has a 90% market share in outpatient surgery in the northern Kentucky counties, and they think they can bring higher quality, lower cost service to the region by opening this surgery center.
Business model, business practice, the American way seems that competition lowers the prices for patients. Would that be the case here?
Well, not necessarily. I mean, St. E. argues that there are 9 surgery centers already operating, and 5 of those centers are at 52% capacity or less. So they think a better solution would be for Christ Hospital doctors to get credentialed at St. E. and use their centers for surgery.
How do we find out if this is going to happen or not happen?
Well, by June, there should be a ruling from the Kentucky Cabinet for Health and Family Services. After that, it can be appealed first to the Franklin Circuit Court in Frankfort, and then to the Kentucky Court of Appeals. How long?
That could be years.
Yeah, it could be years. St. E.'s attorney said there's potentially 3 to 4 years of legal battles ahead over this. The question is whether Christ Hospital, if they're successful in this first round or on appeal, will they break ground on this $24 million facility?
So, and that will be at the old Drawbridge site?
That's right. It's on Buttermilk Pike, yeah. And the plan is for not only a $24 million surgery center, but if that gets built, they'll also add medical office and a freestanding emergency room, and then Brandy Corp, a Northern Kentucky developer that's in charge of the project, will build retail and perhaps a hotel on the site. So it's a $135 million project if everything moves forward, but it's really dependent on this anchor, the $24 million surgery center.
Dan Monk's article is up and running right now on WCPO.com. It is an interesting blow-by-blow on both sides of what you could call a hospital turf war.